The Universal Declaration of Human Rights is unambiguous. Article 25 states that everyone has the right to a standard of living adequately for their health and well-being, including medical care and necessary social services. Article 3 protects the right to life, liberty, and security of a person. Reproductive health care is a human right, and yet today, funding cuts, legislative rollbacks, and policy decisions are removing access for millions of women in Tanzania, in Texas, and all over the world, including in many of our own cities. In the aftermath of the deadliest war in human history, world leaders came together with the shared conviction that certain rights belong to every human being simply by virtue of being human. The United Nations adopted the Universal Declaration of Human Rights, proclaiming that every person on Earth is entitled to life, liberty, health, and security. But for much of the world, that promise has never fully reached women. The UN also adopted CEDAW, the Convention on the Elimination of All Forms of Discrimination Against Women, committing signing nations to protect women's rights in healthcare, education, and reproductive autonomy. 189 countries have ratified it. The United States has not. That absence reflects a question that should have been settled long ago. Do women have the right to make decisions about their own bodies? For nearly 50 years, the Supreme Court said yes. In 2022, that changed. The court overturned Roe v. Wade, erasing half a century of constitutional protection in a single ruling. 13 states had abortion bans written in advance, designed to activate the moment Roe fell. Within hours, abortion was illegal across the South and Midwest. In most of these states, no one voted for these bans. After Dobbs, even medication became a target. Mifepristone, used in more than half of all abortions, was taken to court seeking to erase its federal approval entirely. Reproductive health care remains one of the most underfunded and deprioritized areas of public health in the world. ACTUM Giving partners with organizations around the world working directly with communities to support access to reproductive health care, education, and maternal care. This documentary is about how funding decisions have direct consequences for human lives, especially for women and children. In 2025, the Trump administration withheld $65.8 million in Title X funds and proposed eliminating the program entirely. That same year, USAID effectively ceased operations. Over 90% of staff laid off, 83% of contracts canceled. The United States provided 43% of all global family planning aid. Almost 2/3 of that support went to Africa. When it disappeared, the consequences were immediate. In Tanzania, ACTUM partners with CCBRT and the Kupona Foundation, two organizations on the front lines of maternal health and one of the countries hit hardest by these cuts. Every year in Tanzania, 11,000 women die from complications of pregnancy and childbirth. Over 50,000 babies do not survive their first month of life. And every year, more than 3,000 women develop a condition that changes everything. Obstetric fistula is a childbirth injury caused by prolonged obstructed labor. The tissue dies and a hole forms between the birth canal and the bladder or rectum. The result is uncontrollable leakage that does not go away on its own. 90% of cases, the baby does not survive. For the woman who does, the injury is only the beginning. In many Tanzanian communities, fistula is not understood as a medical condition. It is interpreted as a curse. 2/3 of women with fistula report being socially isolated. Many are abandoned, excluded from community life, separated from the daily rhythms that give life meaning. Some live with this condition for decades because stigma, distance, and costs make care feel unreachable. This is where CCBRT and the Kupona Foundation come in. Together, they provide fistula repair surgery at no cost to patients, transportation, the procedure, a 2-week recovery stay with counseling, and community. Each surgery costs around $2,100. 90% of women receiving this treatment are completely healed. Since 2003, over 5,200 repairs have been performed. The Mabanidi Center also supports women in rebuilding their economic independence and their standing in the communities that once turned their backs on them. ACTUM Giving is proud to support this work, contributing to an initiative that has already transformed thousands of lives and that grows more critical with every dollar of foreign aid that disappears. The funding crisis is not only felt abroad. Back in the United States, communities are losing access too. For millions of Americans, Planned Parenthood is not a political symbol. It's a doctor's office. Often, it's the only one they have. 2.1 million people received care at Planned Parenthood health centers last year. More than half were covered by Medicaid, meaning they had no other affordable option. 85 to 90% of all Planned Parenthood services are preventative care: contraception, STI testing and treatment, cancer screenings. In 2020, 1 in 3 women receiving contraceptive care from publicly supported clinics received that care from Planned Parenthood. Nearly 40% of Planned Parenthood's revenue comes from government funding, primarily Medicaid reimbursements for those preventative services. On July 4, 2025, the One Big Beautiful Bill Act effectively blocked Medicaid payments to Planned Parenthood for 1 year, for cancer screenings, for birth control, for the care that has nothing to do with the debate of abortion and everything to do with survival. As a matter of fact, federal funds for abortion have been prohibited since 1976 under the Hyde Amendment. In September 2025, Planned Parenthood covered $45 million in care for Medicaid patients out of its own reserves, trying to keep the doors open. Nearly 50 Planned Parenthood facilities have shut down since the start of 2025. When those doors close, there is nowhere else to go. Nowhere is that absence more visible than in Texas. Texas has the highest rate of uninsured women of reproductive age in the entire country. Nearly 1 in 4 women between 18 and 45 have no health coverage at all. Since the abortion ban, maternal mortality in Texas has risen 56%. Behind those numbers are girls, young women who have rarely, if ever, had access to basic health care, who don't know what they are entitled to, who don't know how to advocate for themselves, who have never had a provider sit with them and explain what is happening in their bodies. And that gap in knowledge is its own kind of harm. A girl who doesn't understand her own body cannot advocate for it. She cannot recognize when something is wrong, ask the right questions, or know that she has options at all. Healthcare literacy is not a luxury. In Houston, one organization has been working with these girls directly. The TLW Transformation Center is a residential facility serving girls ages 6 to 17, young women navigating trauma, emotional and behavioral challenges, and mental health needs. For many of them, the healthcare system has never shown up. Together with Global Impact Project, we're changing that. Global Impact Project exists because access to care is a right, not a privilege. And in communities like this one, that right has been systemically withheld.
Hi, I'm Isha Aurora. I am the co-founder of Global Impact Project. We started Global Impact Project back in October of 2023. Our initiative is based around children, and it is all about holistic education. Children should not just be in the classroom and learn, but how to keep children in the classroom is really important. And that's through initiatives like nutrition, sportsmanship, leadership, innovation. We work with organizations in Houston, Austin now to help drive that mission. And a big part of what we do is partnerships as well. Partnering with Nirvonics through Global Impact is going to be so impactful because healthcare is something that needs to be more well educated on.
Our goal is to focus on women in the Houston area. And one of the primary reasons for that is because there is a lack of access to healthcare in this particular population.
And we also want to do a focus on reproductive rights across the world. I think in the US, we've seen that there's a lack of education around that. And so partnering with Nirvonics to either get into schools or to shelters to either do screenings or educational initiatives is going to be huge.
In partnership with Nirvonics, Global Impact Project is bringing a free pop-up clinic directly to the girls at TLW. Blood panels, mental health screenings, reproductive health education. What Global Impact Project and Nirvonics are building, funded by ACTUM Giving, is a community pop-up clinic that comes to the girls who cannot come to it.
The goal with this clinic is to not only provide diagnostic information, but to educate women about what their rights are in Texas, and at least to show them that there are ways to get healthcare. There's so many options that we can be educating women and men about now. And I think this could save a lot of emotional distress and a lot of healthcare dollars as well.
A lot of the shelters we go to is just, here is a contraceptive and you'll figure it out, or they have these things, right? So true impact is like saying, just even the psycho-emotional well-being and having a conversation with someone on how to protect that space mentally, because it starts from up there, and just aligning yourself. Your body follows your mind and your emotions, right? So care is not limited. care is not stigmatized. I think that's the biggest thing when we're visiting shelters and like foster homes, right? It doesn't have to be the headache or the eyesight, or it doesn't have to be a severe disability, and everything matters. Like everything about a human being and its well-being matters, and that's it. We have major policies in our face, like Roe v. Wade being repealed. Like the system is what the system is, right? And in spite of what the system is and how it's shaped and formed, we just have to keep powering through and doing what we have to do, right?
The funding cuts of the last several years have reached communities like this one directly. But this is not only a Houston story. Across the United States, girls face significant barriers to basic health care. And it is girls like those at TLW who are most likely to age out of the system before they ever receive the preventative care and health education that could have made a difference. Research consistently shows that individuals who lack access to healthcare and health education in adolescence are significantly less likely to seek or receive care in adulthood. We live in a moment where information is contested, and it is harder than ever to know what is actually happening in the world. There are partnerships with CCBRT, the Capona Foundation, and Global Impact Project, and in solidarity with Planned Parenthood, we are on the ground bearing witness to what policy decision looks like when they land on real people. You've probably heard the phrase America First, but it raises a deeper question than domestic priority. It raises the question of how seriously any nation takes universal humanitarian law at all. CEDAW exists, the UDHR exists, and yet when violations occur, there are rarely consequences. If governments can ignore international human rights commitments without accountability, what exactly is the enforcement mechanism for a right that is supposed to belong to everyone? In a world where truth is contested and every narrative is disputed, is there still such a thing as a universal human right? How we answer that question determines the kind of world we are building.